Medical Assistant Practice Test. Question 1. Of the following structures, which would be located in the mediastinum? A. Occipital lobe. B. Aorta. C. Left carotid artery. D. Pancreas. The mediastinum is the central area of the thoracic cavity. It includes the heart, trachea, esophagus, thymus, and other parts of the central chest. The aorta is the main artery of the circulatory system and starts at the top left ventricle of the heart. The occipital lobe is in the brain, the left carotid artery is in the neck, and the pancreas is in the abdomen. Question 2. The point at which an impulse is transmitted from one neuron to another is A. Nerve center. B. Synapse. C. Dendrite. D. Terminal plate. The synapse would be considered the point at which an impulse is transmitted from one neuron to another. This is a small gap that exists between the neurons. The nerve center is where there is a group of nerves connected to each other. The neuron consists of projections referred to as axons and dendrites. The dendrite works by bringing information to the neuron. The axons take information away from the neuron. At the terminal plate is where an impulse travels from the neuron to the muscle. Question 3. Which of the following terms is spelled incorrectly? A. Bacterial. B. Bacteriolagy. C. Bactericidal. D. Bacterium. Bacteriolagy is spelled incorrectly. It should be bacteriology instead. Bacterial, bactericidal, and bacterium are spelled correctly. Question 4. In a human, urine flows through the urinary system in which order? A. Bladder, urethra, kidney, urethral meatus, ureter. B. Bladder, kidney, ureter, urethra, urethral meatus. C. Kidney, ureter, bladder, urethra, urethral meatus. D. Urethra, bladder, ureter, kidney, urethral meatus. In a human, the urine flows through the kidneys, ureter, bladder, urethra, and urethra meatus. Remember, the urine is formed in the kidneys, so the chain starts there. The urine then travels down the ureters to the bladder and then out of the bladder via the urethra and the urethra meatus. Question 5. Which bone is found superior to the patella and inferior to the ischium? A. Calcaneus. B. Femur. C. Ulna. D. Tibia. The femur is found superior to the patella and inferior to the ischium. This is the upper leg long bone that extends inferior from the ischium and superior to the patella. Question 6. Which abdominal region lies just distal to the sternum? A. Epigastric. B. Umbilical. C. Lumbar. D. Hypogastric. The abdominal region that is distal to the sternum would be the epigastric region. There are 9 abdominal regions. Question 7. Blood flows from the heart's right ventricle into the A. Left ventricle. B. Right atrium. C. Pulmonary artery. D. Pulmonary vein. The blood flows from the right ventricle of the heart to the pulmonary artery. This is the only time in the body that an artery carries blood that has been used and is deoxygenate. Question 8. Which of the following terms is spelled correctly? A. Gastrointestinal. B. Gastrointestinal. C. Gastrointestinal. D. Gastrointestinal. The gastrointestinal tract consists of the mouth, esophagus, stomach, and then the intestines. It consists of taking food in, digesting it, and expelling it. Question 9. Gas exchange in the lungs occurs in one-celled air sacs called A. Alveoli. B. Bronchi. C. Capillaries. D. Pleurae. The alveoli is a one-celled air sac in the lungs where the air exchange takes place. The bronchi are the 2 large air passages that lead from the lungs to the trachea. The capillaries are the smallest blood vessels in the body. These carry blood from the arterioles to the venules. The double-layer membrane which separates the lungs from the chest wall would be the pleura. Question 10. If a patient has rhinorrhea as a symptom, this means which of the following? A. Mucus discharge from the nose. B. Excessive tearing from the eyes. C. Excessive drooling. D. Excessive fluid in the ear. Rhinorrhea is when the mucus glands in the nose are producing more mucus than can be absorbed. Commonly known as a runny nose, it is quite a common symptom. Epiphora is excessive tearing in the eyes. Hypersalivation is excessive drooling. Otitis media causes excessive fluid in the middle ear. Question 11. What is adipose tissue in the body? A. The outer layer of the skin. B. The whites of the eye. C. The sac around the heart. D. The fatty tissue in the body. The term adipose means where the fat cells are stored. The whites of the eye are called the sclera, the outer layer of skin is called the epidermis, and the sac around the heart is called the pericardium. Question 12. Which of the following would be indicated if a patient came in with arthralgia? A. Trouble swallowing. B. Joint pain. C. Inflammation to a sweat gland. D. The headache. Artho means to do with a joint or articulation, and algia indicates pain. This is quite a broad term indicating pain in any joint in the body. Aphasia is the inability to speak, caused by a brain injury or stroke. Hidradenitis is an inflammation in a sweat gland. Cephalgia is a headache. Question 13. Which of the following would be considered a part of the large intestine? A. Ileum. B. Transverse colon. C. Duodenum. D. Jejunum. The transverse colon is part of the large intestines, along with the ascending colon and descending colon. The large intestine is considered to be the colon, which also includes the sigmoid colon and the rectum. The small intestines consist of the ileum, duodenum, and the jejunum. Question 14. Adipose tissue is made of A. Fat cells. B. Lymph nodes. C. Muscles. D. Skin. A person's adipose tissue is made up of fat cells. These fat cells are referred to as adipocytes. They synthesize and contain large globules of fat. These are mainly found under the skin, but can also be between the muscles. Question 15. The prefix brady, as in bradycardia, means A. Fast. B. Irregular. C. Slow. D. Without. The prefix brady means slow. It is used in terms such as bradycardia, meaning an abnormally slow heart rate. The prefix for fast would be tachy. Question 16. Of the following, which would a certified medical assistant typically be able to perform when assisting the physician in the exam room? A. Assist with minor procedures. B. Start and for therapy. C. Administer medications by the intravenous route. D. All of the above. When a certified medical assistant is assisting a physician in an exam room, they typically assist with minor procedures. They are never allowed to start and for or administer medications by the for. Question 17. When washing hands, the three most important factors include A. Antibacterial soap, length of time spent in hot water. B. Friction, soap and warm running water. C. Position of the hands, friction and water temperature. D. Length of time spent, type of soap, and running water. Washing hands in a healthcare facility is considered the most important step in the prevention of spreading infections. The most important factors include friction, soap, and warm running water. Question 18. In a healthcare facility, which of the following agencies or organizations work to set the standards for the safety of the employees? A. GOSHA. B. NLN. C. AMA. D. JCOH. The organization that sets these standards is the Occupational Safety and Health Administration, OSHA, part of the United States Department of Labor. Question 19. When a clinic writes a statement which sets the level of care that is to be provided, it would be considered which of the following? A. Mission. B. Standard. C. Objective. D. Requirement. When a clinic or other healthcare facility writes statements which sets the level of care to be provided, it is considered standards or standards of care. Question 20. In order for the healthcare facility to comply with the Health Insurance Portability and Accountability Act, HIPAA, each patient is to be given which of the following? A. A list of the employees and their credentials. B. The staff's work schedule. C. Office policies. D. Patient rights and privacy practices. According to HIPAA, each patient is to be given a statement of the privacy practices of the facility/clinic, patient rights and privacy practices. Question 21. Typically, in an outpatient situation, which of the following is the main reason for the visit shown in the admission record sheet? A. The first listed diagnosis. B. The principal diagnosis. C. The secondary diagnosis. D. The primary symptom. Typically, in outpatient care, the reason for the visit is the diagnosis that is listed first in the admission record sheet. Question 22. Before making rounds, a medical assistant should be sure that they are carrying which of the following on their person? A. A pen. B. A syringe. C. A glucose meter. D. A change of clothes. When making rounds, a medical assistant should always carry a pen with them to record changes and readings. Question 23. When would Korokov sounds be evaluated? A. Determining blood pressure. B. Counting respirations. C. Evaluating pulse. D. Performing ultrasonography. The Korokov sound is evaluated when determining the patient's blood pressure using a sphygmomanometer and stethoscope. Question 24. For a medical assistant, which aspect of an exam room practice precedes the other listed techniques? A. Listening. B. Treating. C. Problem solving. D. Procedure. One of the most important things that you can do in the exam room is listen. If you are not listening and documenting each complaint or symptom, then there could be a misdiagnosis. Question 25. Which of the following is important for the medical assistant to do before and after contact with the patient? A. Record their interaction. B. Ask the patient questions. C. Disinfect or wash your hands. D. File a claim with the insurance company. You should always disinfect or wash your hands before and after contact with the patient to help prevent the spread of disease or infections. Question 26. If an infection is nosocomial, it means which of the following? A. Contracted within the hospital. B. Originates outside of the body. C. Contracted by touch. D. That originates from within our own body. Nosocomial means that the infection was contracted while the patient was in the hospital. Question 27. When pathogenic organisms are killed or destroyed, it is called which of the following terms? A. The sepsis. B. Disinfection. C. Antisepsis. D. Cleaning. Disinfection kills all of the pathogenic organisms. This process is typically done using chemicals. Question 28. If a patient is tested to determine the antibiotics that a pathogen is susceptible to, what type of test is being conducted? A. Sensitivity. B. Biopsy. C. Culture. D. Cytology. If the aim of testing is to determine if a pathogen is susceptible to an antibiotic, it would be considered a sensitivity test. Question 29. A female patient comes into the clinic presenting with pain in the abdomen. The doctor notes that this could be dysmenorrhea. Which of the following best describes this diagnosis? A. Painful menstruation. B. Fluid-filled sac on the ovary. C. The tear or split in the abdominal wall. D. Kidney stone. Dys means difficulty or pain, meno means menses or menstruation, and rhea means discharge or flow. Dysmenorrhea is painful menstruation. Question 30. A patient comes into your clinic and is having difficulty breathing unless they are in an upright position. Which of the following is the proper medical term for this condition? A. Menarche. B. Lithiasis. C. Orthopnea. D. Gynecomastia. Ortho means straight or erect and nea means respiration or breathing. Orthopnea is the condition where an individual has trouble breathing when lying down. Question 31. If a man comes into the clinic and the doctor observes that he has gynecomastia, it would point to which of the following? A. Swollen glands in the neck. B. Overdevelopment of breast tissue. C. A blood clot in the leg. D. Kidney stones. Gyne is used to describe anything female and mastia refers to the breast. Gynecomastia is the overdevelopment of breast tissue in a male. Question 32. Which of the following should a medical assistant do while the patient is explaining their symptoms? A. Make eye contact and listen. B. Avoid eye contact and listen. C. Prepare for the next patient. D. Multitask. The most important thing a medical assistant can do when a patient is explaining symptoms is to make eye contact and listen. Question 33. If a paper medical record needs to be corrected, which of the following would be an acceptable way to make the correction? A. Erase the portion of note that needs to be corrected. B. Draw one line through the portion of the note that needs to be corrected and initial it. C. Use whiteout on the incorrect entry. D. Shred that page of the chart. If a correction is needed on a patient's paper chart, a single line needs to be made through the incorrect portion and then the person making the correction needs to date, time and initial it. Question 34. Making a note in one file that a paper is in another file is called underscore 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 underscore. A. Cross-filing. B. Indexing. C. Conditioning. D. Cross-reference. Making a note in one file that a paper is in another file is called cross-reference. Question 35. Which of the following abbreviations refer to intracranial pressure that might be seen documented in a patient's chart? A. FACE. B. FMLA. C. CVP. D. ICP. Intracranial pressure is listed as ICP in medical terms. Increased ICP can be life-threatening. Question 36. Computer underscore 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 is considered the computer's physical equipment. A. Hardware. B. Boot. C. Software. D. Application. Hardware is considered a computer's physical equipment. Boot is starting it, and software is the programming. Question 37. If a medical record is problem-oriented, POMR, this means that each medical condition is assigned which of the following? A. Letters. B. Numbers. C. Time. D. Date. If a medical record is a problem-oriented medical record, POMR, each condition is assigned a number for tracking purposes. Question 38. Which of the following would describe a medical record that is categorized by date and time? A. Alphabetical. B. Numerical. C. Chronological. D. Terminal digital. Chronological medical records are categorized by date and time. Question 39. Which of the following would EMR refer to? A. Emergency magnetic resonance. B. Emergency medical records. C. European medical research. D. Electronic medical records. EMR stands for electronic medical records. They provide accuracy and ease of access. Question 40. Word processing software may be used by a medical assistant to create which of the following? A. Superbills. B. Record of all patients and their addresses. C. Inventory of office supplies. D. Transcriptions. Word processing software can be used by a medical assistant to create transcriptions, text documents. Question 41. A cystoscope is most commonly used by a specialist in A. Endocrinology. B. Urology. C. Gynecology. D. Gastroenterology. A cystoscope is most commonly used by a specialist in urology to check the urethra and bladder. Question 42. Which of the following would be used to indicate someone has taken a file from the file cabinet? A. Patient chart. B. Out guide. C. Tickler file. D. Summary form. The out guide is used to indicate when a person takes a file from the file cabinet. Question 43. Before referring a patient to another facility, a medical assistant should be sure to verify the patient's A. Address, B. Income, C. Insurance, D. Transportation. A medical assistant would need to verify the patient's insurance before transferring the patient to another facility. Question 44. A client would not be billed in which of the following situations? A. Where workers' compensation covers the injury and care. B. Where the patient has Blue Cross. C. Where the patient has no insurance. D. Where there's an indemnity insurance plan. If the client is being seen for a workers' compensation injury, the patient would not receive a bill, it is sent to the workers' compensation department. Question 45. A ________ must typically be paid by the patient at each visit when services are rendered at a doctor's office. A. Copay. B. Premium. C. Deductible. D. Fee schedule. A copay is a fixed amount for health services set by a policy that must typically be paid by the patient at each visit. Question 46. When billing for ambulatory care, it would indicate which of the following? A. Use of an ambulance emergency service. B. Assignment of benefits. C. Outpatient classification structure. D. Outpatient services provided. Billing for ambulatory care refers to outpatient services that were provided. Question 47. If a patient has end-stage renal disease, which of the following acronyms would be used when coding? A. NSTRD. B. DSRD. C. End-stage RD. D. DS renal disease. End-stage renal disease is listed as ESRD in medical coding. Question 48. A pregnant patient's medical chart states air 150 bpm. What does this indicate? A. Electronic health record. B. Embryonic hereditary range. C. Embryonic heart rate. D. Mother's heart rate. AIR is the embryonic heart rate, or FHR for fetal heart rate. Question 49. Of the following, which would not be considered to be a part of effective communication? A. Message. B. Noise. C. Sender. D. Feedback. Noise is not considered a part of communication. Parts include message, sender, receiver, and feedback. Question 50. Which of the following is the center of the brain that controls fear, aggression, and anxiety? A. Amygdala. B. Cortex. C. Thalamus. D. Hippocampus. The amygdala is the center of the brain that controls reflexes and emotions such as anxiety, aggression, and fear. Question 51. Maslow's hierarchy of needs includes which of the following? A. Money. B. Direction. C. Self-loathing. D. Self-esteem. Self-esteem is considered to be one of the 5 levels of Maslow's hierarchy of needs. Question 52. If a patient acts extremely rude to a medical assistant because their insurance does not cover their visit to the clinic, it would be considered which of the following? A. Displacement. B. Denial. C. Compensation. D. Sublimation. Displacement is when a person transfers emotions about a situation onto an external substitute, like acting rude to a medical assistant. Question 53. When a medical assistant is able to listen to a speaker's problem and understand the speaker's personal point of view, it is called A. Nonverbal communication. B. Critical listening. C. Appreciative listening. D. Empathetic listening. Empathetic listening is when one is able to listen and see from the speaker's point of view. Question 54. When someone listens for particular things and blocks out what they do not want to hear. A. Full listening. B. Selective listening. C. False listening. D. Listening barrier. Selective listening is when the listener blocks out the parts of the message that they do not want to hear. Question 55. Which cranial nerve is related to the sense of smell? A. Hypoglossal. B. Olfactory. C. Trochlear. D. Vagus. The olfactory nerve, cranial nerve 1, is related to the sense of smell. Question 56. A medical procedure cannot be performed on a patient until the doctor obtains underscore 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 underscore. A. Confidentiality. B. Informed consent. C. Insurance authorization. D. Vital statistics. An informed consent should be obtained prior to a medical procedure being performed. Otherwise, it could be legally considered assault and battery. Question 57. A medical assistant is at a bar with her close friend and they get to talking about work. The medical assistant informs her friend that the friend's teacher was in the doctor's office getting checked out for kidney stones. This would be considered which of the following? A. Breach of confidentiality. B. Assault and battery. C. Professional malpractice. D. Slander and defamation. Discussing a patient in public is a breach of confidentiality under HIPAA. Question 58. Of the following, which would the HIPAA requirements apply to in a healthcare facility? A. Physicians. B. Nurses. C. Certified nurse aides. D. All of the above. HIPAA requirements apply to all employees in a healthcare facility, including physicians, nurses, and aides. Question 59. A 17-year-old woman who is married arrives at the emergency department of a hospital with an injured arm. Who must consent to any treatment since this patient is a minor? A. Spouse and minor. B. Parent. C. Patient. D. The parent and the patient. If the 17-year-old woman is married, she is considered emancipated and can give consent herself. Question 60. If a medical assistant touches a patient with the intention of harming them, it would be considered which of the following? A. Malpractice. B. Battery. C. Harassment. D. Assault. Battery occurs when a person touches another person with the intention of causing them harm. The threat is assault. Question 61. If a clinic charges a patient's insurance for treatments that were not done, it would be considered which of the following? A. Malpractice. B. Fraud. C. Assault. D. Embezzlement. Charging for treatments that were never performed is considered fraud. Question 62. If a medical assistant is underscore 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 underscore, it means that the medical assistant performs her duties in compliance with the standards of her job description. A. Dependable. B. Negligent. C. Competent. D. Trustworthy. Competence means having the ability, knowledge, and skill to perform duties successfully to required standards. Question 63. When hiring a new employee, which of the following forms is needed when they are choosing tax exemptions? A. I-9. B. 1099. C. W-4. D. 1096. The W-4 form is used by the employer to determine the amount of federal income tax to withhold based on exemptions. Question 64. If a patient's bill has been unpaid for more than 90 days, which of the following would call the patient? A. Attorney. B. Medical assistant. C. Collection agency. D. Physician. Once a bill reaches 90 days overdue, it should be turned over to a collection agency. Question 65. If a medical assistant managing patient payments learns that a patient's check has been returned due to insufficient funds, what step should the medical assistant take first? A. Call the patient. B. Call the police. C. Notify the collection agency. D. Call the patient's employer. The first action should be to call the person who wrote the check. Question 66. What financial record in a clinic is typically the most active? A. Accounts payable. B. Employee payroll. C. Accounts receivable. D. Malpractice liability. Accounts receivable records, what patients owe/pay, are typically the most active records in a clinic. Question 67. Good team members underscore 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 underscore. A. Focus on their tasks and not on some lofty goal. B. Do not communicate with or interfere with others. C. Do their job well without helping others with theirs. D. Accept responsibility and accountability. Good team members accept responsibility and accountability, focus on goals, and help others. Question 68. Once an employee is hired, within how many days does the employer have by federal law to have the I-9 form completed and verified? A. 30 business days. B. 14 business days. C. 3 business days. D. Within the first year. The I-9 form must be completed and verified within 3 business days of hire. Question 69. When checking the identity of a patient, most healthcare facilities require that the patient present underscore underscore forms of identification. A. 3. B. 1. C. 0. D. 2. Most facilities require 2 forms of identification/verification. Question 70. If an individual is going to be using a computer for long periods of time, they should do which of the following? A. Adjust the chair height and monitor to a comfortable position. B. Sit as long as you can without moving. C. About once an hour, stand and stretch. D. Both A and C. One should adjust their equipment for ergonomics, A, and stand/stretch regularly, C. Question 71. A patient is always late for their scheduled appointments. The office manager spoke to the patient about the issue, but it has not changed the patient's behavior. Which of the following is an appropriate next step? A. Always schedule them at the end of the day. B. Charge them a late fee. C. Force them to find another doctor. D. Have a heart-to-heart talk. If a patient is perpetually late, scheduling them at the end of the day is an appropriate next step. Question 72. What type of booking or scheduling is used if a medical assistant brings multiple patients into the office at the top an hour and they are seen on a first-come, first-served basis? A. Double booking. B. Wave scheduling. C. Standard procedure. D. Time-specific scheduling. Wave scheduling involves scheduling multiple patients at the beginning of the hour. Question 73. Call screening in a medical office is important because it allows a medical assistant to do which of the following? A. Avoid taking walk-ins. B. Avoid patients that are not emergency. C. Make sure the patient is properly triaged. D. Avoid patients that have caused trouble. Call screening allows the medical assistant to properly triage patients by priority. Question 74. As a medical assistant, when a patient calls to cancel an appointment, you should do which of the following? A. Have the doctor call them. B. Inform them they cannot reschedule. C. Tell them the office is too busy. D. Process the cancellation and talk to the patient about rescheduling. The medical assistant should process the cancellation and discuss rescheduling with the patient. Question 75. Which of the following treats a patient that has diseases of the blood? A. Cardiologist. B. Pulmonologist. C. Podiatrist. D. Hematologist. A hematologist treats patients with diseases of the blood. Question 76. Calcium, potassium, and sodium are all classified as A. Androgens. B. Electrolytes. C. Estrogens. D. Prostaglandins. Calcium, potassium, and sodium are classified as electrolytes. Question 77. Which is the term for an abnormally low white blood cell count? A. Anemia. B. Leukemia. C. Leukocytosis. D. Leukopenia. Leukopenia is the term for an abnormally low white blood cell count. Question 78. In the periodic table, K is the symbol for A. Calcium. B. Iodine. C. Phosphorus. D. Potassium. K is the symbol for potassium. Question 79. Which blood type would be considered the universal donor? A. TB. B. O+. C. O-. D. B. O is the universal donor blood type. Question 80. Underscore 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 is a protein in plasma which forms blood clots and stops excessive bleeding during tissue or vascular injury. A. Erythrocytes. B. Leukocytes. C. Reagent. D. Fibrinogen. Fibrinogen is a protein in plasma that forms blood clots. Question 81. A condition of insufficient blood clotting cells is referred to as A. Thrombocytopenia. B. Thrombophlebitis. C. Erythrocytes. D. Erythrocytosis. Thrombocytopenia is a condition of insufficient blood clotting cells, platelets. Question 82. Of the following, which would be considered the first step in treating a patient with a chemical burn of the skin? A. Wash with soap and water. B. Apply an antiseptic ointment. C. Apply ice. D. Flush area with water. Flushing the area with cool water for at least 20 minutes is the first step for a chemical burn. Question 83. If a patient has severe burns over more than half of the body and the burning process has been stopped, which of the following should be the next step? A. Starting 4 antibiotics. B. Applying antibacterial ointment. C. Administering high-flow oxygen. D. Wound debridement. High-flow oxygen should be administered next for severe burns to help with airway management. Question 84. If a patient is admitted with a cut that is still bleeding, which of the following should be done first? A. Stitch wound. B. Apply antibiotic ointment. C. Get a tetanus shot. D. Stop the bleeding. Stopping the bleeding, usually by applying pressure, is the first priority. Question 85. If an elderly patient suddenly has an onset of confusion, with no previous disorders, what would be the most likely explanation? A. Urinary tract infection. B. Dementia. C. Hypoglycemia. D. Alzheimer's. Urinary tract infections are a very common cause of sudden confusion in elderly patients. Question 86. Which of the following symptoms would a patient exhibit that could be indicative of cerebral edema? A. Abdominal pain. B. Itching. C. Seizures and coma. D. Normal vision. Seizures and coma can be indicative of cerebral edema. Question 87. A paramedic informs the medical assistant that a patient has had a cardiac arrest. What does this mean? A. Irregular heartbeat. B. Blood flow interference. C. Variation in rhythm. D. Sudden stoppage of the heartbeat. Cardiac arrest is the sudden stoppage of the heartbeat. Question 88. The pharmaceutical abbreviation QID means underscore 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 underscore. A. Every hour. B. Every day. C. 4 times a day. D. Every week. The abbreviation QID means 4 times a day. Question 89. If medication has been ordered by a physician to be taken PC, it should be given A. Before meals. B. At hours sleep. C. After meals. D. Every 4 hours. The abbreviation PC stands for after meals, post-SIBUM. Question 90. The pharmaceutical abbreviation BID means underscore 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 underscore. A. Once a day. B. Twice a day. C. Once a week. D. Twice a week. The abbreviation BID means twice a day. Question 91. If medication of a patient or resident is indicated as PRN, it is given A. Once a day. B. When necessary. C. By mouth only. D. To discontinue use. PRN, pro re nata, means when necessary. Question 92. All of the following are narcotic or narcotic-like analgesics, except A. Ibuprofen. B. Hydrocodone/APAP. C. Oxycodone/acetaminophen. D. Tramadol. Ibuprofen is a non-steroidal anti-inflammatory, not a narcotic. Question 93. Which of the following classifications of medications would be helpful in treating the patient that is complaining of heartburn? A. Beta blockers. B. Antacids. C. Analgesics. D. Antibiotics. Antacids are used to treat heartburn. Question 94. If a patient is prescribed a diabetic agent such as metformin, which of the following reactions should the patient expect? A. Increase in glucose. B. Decrease in blood pressure. C. Decrease in blood glucose level. D. Vomiting. Diabetic agents are intended to decrease blood glucose levels. Question 95. Of the following, which medication would typically be ordered to help a patient to get rid of excess fluid in their lungs? A. Furosemide. B. Erythromycin. C. Digoxin. D. Carvedilol. Furosemide, Lasix, is a diuretic used to remove excess fluid from the body. Question 96. A patient is diagnosed with a blood clot in their left lower leg and is hospitalized. Which of the following would more than likely be prescribed per intravenous solution? A. Warfarin. B. Heparin. C. Enoxaparin. D. Furosemide. Intravenous heparin is a common initial treatment for a blood clot, anticoagulant. Question 97. Which of the following would be considered a muscle relaxant that might be ordered for a patient with back pain? A. Oxycodone/acetaminophen. B. Hexachlorophene. C. Bismuth subsalicylate. D. Methocarbamol. Methocarbamol, Robaxin, is a muscle relaxant. Question 98. If the physician prescribes a low-fat diet for a patient, which of the following should they be able to eat? A. Whole milk. B. Chicken with skin. C. Cake with icing. D. Boneless, skinless chicken breast. A low-fat diet allows lean meats like boneless, skinless chicken breast. Question 99. Of the following, which would be considered the correct percentage of nutrient intake for a person's protein intake every 24 hours? A. 15%. B. 65%. C. 25%. D. None of the above. The recommended nutrient intake for protein is approximately 15%. Question 100. Of the following, which describes the body's ability to maintain its normal state? A. Anabolism. B. Catabolism. C. Metabolism. D. Homeostasis. Homeostasis is the body's ability to maintain its normal, stable state.